And that's part of the biggest message that we want to drive home is that, it's, I mean, long story short, it's just that we're more than black men in hoodies, and we're not, we're more than a hoodie, we're more than what's on the news about us, right? And there's so much good that we're doing out there that doesn't get covered, to be honest, doesn't get highlighted and spotlighted, and it's always tends to be more of the negative things. And so, that's why, part of what we're doing, and it's similar to part of what you all do, is to put a face to medicine, put a face to what's actually going on, is to show that, hey, we're doing these other awesome, amazing things too.
Nothing can stop me. I'm all the way up. All the way up. I'm all the way up.
So, so some you guys decide pretty young, and then let's move the timeline ahead. High school, I imagine you guys did fairly well.
Pretty well, yeah.
As before I get to this spot, where I'm going to is I want to know where you guys went to college and why the decision. But before that, anything crazy in high school? Like what was the thing you were most into in high school outside of the classroom? What did you spend
definitely.
Your time
it was 100% tennis.
I think it was tennis. Yeah, it was tennis. It was everything tennis.
Y'all play doubles?
Yeah, we did doubles.
We played doubles together. Varsity, I think.
Yeah, we started off our first year like doing like junior varsity type stuff, and then by our fourth year, we were on the varsity doing doubles. It was fun. So so
confusing people all the way.
Exactly. Yes, we did use it to our advantage a little bit. So So we grew up playing a lot of tennis, and so that was really the thing that we look forward to every day. We studied for class wise, but at the end of the day, I really actually look forward to the end of the day going to practice tennis. And going to different tennis matches and tournaments and things.
So what life lessons did you learn from tennis?
Wow. It was, I want to say a lot of things actually. I think the first thing I learned is just learning how to coordinate, how to strategize, how to plan out what you want to do. I think that's a really big thing in tennis is, it's more than just hitting a ball back and forth. I know a lot of people that watch tennis on TV and they think it's boring because all they're doing is just hitting this ball back and forth. I'm like, no, there's actually a lot of strategy behind it. And I think that's really one of the first things that I learned that I can attribute to just life is just strategizing, planning out what you want to do, really trying to coordinate to make certain things happen. I think that the second thing that I learned is really being able to persevere, because in tennis, I wasn't the best player. So we definitely came up against people that were far better than us. And it can feel very discouraging when you're out there on the court and you're just getting beaten so bad by people that are like borderline professional. But at the end of the day, you're in it to have fun and you just keep on pushing.
Yeah, it definitely teaches you how to tennis is a very mental game. No matter how many hours that you train or practice, it's all mental, because at the end of the day, it's about what's going through your head in the moment, in the middle of a match. And so you see even the greatest of players, you've seen them, from Roger Federer to Serena Williams, the best of the best can have terrible matches because they're just not in a great headspace, right? And so it teaches you that. It teaches you how to stay calm when things aren't going your way. It teaches you just like you said, how to strategize and anticipate things. And so those are some of the biggest lessons, but I think out of all, it really teaches you how to pick yourself back up, because when you get like you said, when you get creamed out there and it's 1-6 or something, and you're like, man, okay, that was pretty bad. I'm just going to go home now, but it teaches you how to reset and come back again for the next match. And, but it also teaches you that, because we play in sets and matches, you might get killed in one set, but you can easily reset, shake that set off and get ready for the next one. So you really just learn how to kind of reset your mind and get into a better headspace quickly. And so
knowing you get another chance, you always have another chance.
Exactly. So you learn how to change plans and analyze what's not going wrong, or what's not going well, I should say, and make things better moving forward. So
nice. So college. Tell me about the college, decisions. You finished in high school, getting ready for college. Options. What were you looking at? What types of things were going through your mind in terms of picking a college? And of course, because you guys are twins, and you have a lot more to consider that situation. Kind of tell me about those complexities or simplicities.
Yeah. So I remember, we went when we were in high school. So we were grew up mostly in Tennessee, Chattanooga, Tennessee, and we moved to Kansas City, Missouri, because our dad had taken a job out there at the public television station in that city. And so for us, we were applying, we were thinking like, okay, we're, all these options that we have up there is like KU versus like Mizzou and, all these places.
Hey, hold on. Time out. Mizzou. I went to Mizzou, med school, undergrad, go Mizzou. Just have to say, I have to get that out there. Shout out to Mizzou.
All right. Very nice.
But while we're on the Mizzou topic, so I just got a young physician alumni award type of thing, right?
Oh, okay.
But I couldn't attend. No knock to Mizzou, but they mailed me my thing, but they mailed the wrong person's thing to me. So this is not mine. So come on, Mizzou, man. Y'all, I still love y'all, but y'all can send the right awards, man. Send the right awards.
Hopefully they'll get that fixed right. Get you right award.
All right. So tell me why you didn't go to Mizzou. That's what I want to know.
Why didn't
I don't know. I really don't think that was really, I don't think I really seriously considered going to Mizzou.
Yeah, I heard even more.
I know. But I didn't really heavily consider KU either. So
right, yeah. So
I think it's because we were from down south, so we always had UT in our mind, and so that's for us for college, we just kind of really wanted to kind of come back down south and kind of come back home. For us it was, again, home is Tennessee, it was Chattanooga. So that's kind of what we just kind of had set. And even our dad was kind of wondering, he was like, are you sure? Because you get in-state tuition, that would be considered out-of-state because you're not a resident of Tennessee. And we're like, yeah, we're good. But we think we know what we want to do on this one. And it's like, all right, if that's what you want to do. And so we applied for University of Tennessee. We actually ended up going to University of Tennessee at Chattanooga. And so that was, I remember our college experience was pretty nice.
The main campus is Knoxville or
Is Knoxville. Yeah. The main campus is in Knoxville. They also have another campus in Martin, UT Martin, and in I believe Memphis too, if I'm not mistaken. Could be wrong about that, but but we went to University of Tennessee at Chattanooga, and our experience was actually pretty great. I don't regret my decision at all. It was a nice. Actually, I remember liking that campus a lot because the campus wasn't like super huge where it took like all day to walk to the other side of the campus to whatever class you're getting to. It was fairly easy walking around, fairly easy getting around, and actually tuition wasn't too expensive. That was even a plus. Because moving from Tennessee to Chattanooga, we didn't qualify for some of the like automatic scholarships that were like state sponsored and things like that.
So even being quote unquote out of state, tuition still wasn't that bad.
Yeah, it actually wasn't. Yeah. So there's that. And so our dad though, because he had, of course, twins that he was taking care of growing up. He had thought ahead and had did all the saving for college type stuff. So he did all that, which was nice, and we're definitely grateful for that because a lot of people don't get that. And so with that being said, we went to University of Tennessee at Chattanooga, and we did our pre-med classes there. We did did biology majors, and then of course we did like a minor in chemistry. And throughout that time, we made a lot of good friends, lifelong friends there. We still know several of the people that work there. We always reaching back out to them, and everybody has been always very, very supportive. And throughout that time, of course, we were doing the usual pre-med stuff. We were volunteering at the hospital. We shadowing physicians, just trying to be a part of the community as much as possible, and reconnecting, since that was our home. And so we did that. And
did you all find any challenges with the fact that you were back home, maybe some old friends and such? Were there any distractions in that sense, or was it a plus?
Yeah, I mean, we definitely did have some old friends that we grew up with, and I guess I don't want to say we honestly didn't really have, I would say, any distractions per se. I think that we were pretty focused on, by the time we were pretty focused on really just trying to study hard and take all the classes that we need to take so we could go to med school.
We were the people like, like, hey, can you guys want to come out to this, go to this dance, this, that thing, whatever. And usually we were like, no, we got to kind of study for this. All right.
Yeah.
So we were kind of in that headspace, because we were like, look, we're going to get through these 4 years, get to medical school, and that's it. Okay.
Focused.
So yeah.
Did you guys take all the same classes pretty much?
For the most part,
majority of them were together. There were a few that weren't together, but actually for the most part, they were.
Tell me about the importance of accountability. So you guys were each other's accountability buddies through college. Tell me about that. How did that impact your progression, having somebody to study with, keep you accountable and such?
Yeah, it was a plus.
I think it really works. And I think that kind of goes back to kind of what I think our parents really instilled in us in trying to work together along this journey. I think accountability is very important, especially in undergrad, because I feel like it's so easy to really fall off the path that you're trying to, pursue.
Yeah.
I feel like there's just a lot of things that can really kind of throw you off course. And I feel like, by us having one another, it kind of helped us to kind of remain focused on what our end goal is.
Yep.
And just making sure that we were, studying appropriately and preparing for our exams, and just really just trying to stay organized.
Yeah. We did a lot of studying together. We would, and it made it easier whenever, for the most part, whenever we were in the same courses, we could both, to be studying the same thing, and, we would quiz each other on those things, and, basically discuss the things that were, we were having more difficulty with or whatever. And so again, having that sort of automatic, I guess, study partner was a plus. And I attribute a lot of that, because I think back to a lot of times where it's like, man, it's another test.
Mm-hmm.
I don't feel like studying for this test, but because you're not alone doing it, it helps a lot. So
my wife was we did like everything together. So she was my accountability partner, and man, game changer, right? Having that person there is huge game changer. What was the hardest part about your undergrad journey?
That's a good question. The hardest part, let's see here. What would be the hardest part?
Hey, like now it was easy.
Yeah.
So I guess from a class perspective, I could say any classes that were the hardest part, I think for me would have been like biochemistry. And then there was one summer that I did take organic chemistry 1 and 2, pretty much back to back, month to month over the summer. That was pretty hard.
Yeah, yeah, that was pretty hard. I'm not gonna lie, not being able to always go and spend that time with your friends whenever they want to go do stuff, and always having to say no because you know that you have to study for this test, and so that kind of sucks a lot.
Actually, come to think of it, all 4 years we pretty much took classes every summer. So we didn't really have any time off. So I think that was pretty hard.
Yeah. So why did you? So that's fascinating. So why did you guys do that? Because like I did like a summer program pretty much every summer. So why did you guys do classes rather than doing research or summer programs or something like that?
Yeah, that's a good question. So for us, it was more so because we wanted to make sure that we got done on time. At that time we had heard of too many stories where people would, prolong their graduation by a semester, then it was like another semester, then it was like another semester. And we just wanted to be sure that we were getting done on time. I didn't want 4 years to become 4.5 years and 5 years and 5.5 years. I think we were really bent on and determined not to kind of end up in that sort of a situation. I know that, especially doing the pre-med classes and doing biology major, sometimes that can happen a lot actually, because so many courses to fit in per semester, and and then sometimes not every single course was always offered every single semester, depending on how how many people were trying to go for that course, or spots fill up, or so on and so forth. So we're trying to balance all it out and make sure that we just really wanted to get done on time and graduate quickly. And so that was pretty much what motivated that. But in the meantime, we did do a lot of volunteering. We were in the hospital We even at one point worked for the hospital. Actually, we did worked in the lab doing a lot of phlebotomy and stuff. So it was definitely a busy time. But I wouldn't have had it any other way, actually.
Yeah.
So
yeah. I think keeping busy keeps you focused and out of trouble. I'll put it that way.
That's true. Very true. So you guys end up choosing to go to Edward Via, right? Is it Via or Via?
It's both, I guess.
Some people say Via, some people say Via. I say Via.
I don't think there's really a correct way, but I've heard both.
Okay, so you guys choose to take the osteopathic medicine. So why the osteopathic medicine? I was watching I guess not necessarily osteopathic medicine, but I was watching a video recently with the ganglion cysts where they were knocking that thing out, which was a pretty cool video. Like, don't smack a book on it anymore. But so why did you choose that route? Tell us about that route and tell us tell us about that route and tell us the benefits of that, because I know I know all the details, but clearly there's extra stuff that you guys learned from going that route.
Yeah. So I'll kind of start with this, until I think early undergrad, when we talked to a medical school rep, and at that time I actually had not heard of this thing called osteopathic medicine, right? So it was during undergrad that I first learned about it. I was like, what is this osteopathic thing? Like, well, I've never even heard of this before. I actually thought there was just MD. So we kind of got to learning more about it, and learning kind of what the concept was, and kind of what is this thing. And I just kind of really started liking what their approach was to patients and to medicine, and really just seeing, I think, how they can train you to be kind of hands-on diagnostic to a certain extent, kind of really fascinated me at that time. Yeah. And I mean, not to say that MDs are not good, because I think that either path you take is perfectly fine and really good. But I think it was just, I was really fascinated by it. I think that's kind of what it drew me to opening my mind to applying to more osteopathic schools.
Yeah. Just like we said, we really didn't learn about what DO or osteopathic medicine physicians were until we really started heavily applying. And I remember I was like, wait, what? Because I think the first one I heard about was Lincoln Memorial in Tennessee. And I was like, well, what's Lincoln Memorial? I never really, I almost couldn't wrap my mind around the concept. Like, what's going on here? And so, and I remember, after that, I made it a mission. I was like, all right, next time I go to the hospital, I'm just going to look around and actually take note that, how many DOs are actually around here. Come to find out, DOs were everywhere. And I was like, the pathologist was a DO. And I was like, wait, what? you're a DO too? And he was like, yeah.
Nobody asked what your degree is. Everybody's just doctor.
Yeah. Nobody's asking what your degree is. You just, you're doing what you do. You're just doctor at that point. And I was like, man, so that really changed my mindset about DO versus MD. And so at that point, we basically were applying to both. But yeah, we, ultimately we went more for the DO, because just like what he said, we were, we kind of looked it up more, and we were like, man, it's really cool how you can do these manipulations and things with the body. You can, you get really, really heavily in tune with anatomy more. I view things differently now. Like somebody comes in for a knee problem, I just see it so differently.
That's what I really want to know. That's what I want to get at. Are you still using the skill set you learned? So I feel like half the people I know say they still use it. The other half say they don't use it anymore. Are you using the skill set still?
So I'll say there are certain things that I use, whether it's certain soft tissue things. I can't say I always use a lot of the high velocity or HVLA, kind of what they might refer to as the popping bones or snapping necks kind of tool. I can't say I use that as much, but some things are more soft tissue things I will use. And I feel certain techniques that I kind of learned from the school in terms of just diagnosing certain issues, whether it's related to the knee or elbow, I still use those things whenever I'm seeing a patient.
Yeah, so it really helps. It really helps, especially in the diagnostic realm, whenever you're diagnosing musculoskeletal issues, and it just, I don't know, I just feel more confident doing it, I guess. I feel like it's given me a lot of confidence with being more hands-on. So if somebody comes in with a problem, I'm like, oh, give me your knee, give me your shoulder, let me figure this out for you. And so, that I definitely like sort of having that additional skill set. Just for those that may not be aware, we do kind of how it was set up for us. We would do our regular coursework, medical stuff, and then we would always have about 2 or 3 hours of like a lab, basically is what it was. And our lab basically had a bunch of basically what we might call like chiropractic tables, which I'll kind of briefly mention the origins of DO work and chiropractic work. But yeah, we would do like 2 or 3 hours in addition to what we were doing of regular medical studies. And we would learn about how to treat lymphatic issues, how if somebody has lower extremity edema, how you can, do some manipulations to help resolve that or make it less, how to get, lymphatic fluid to flow better. Or if somebody's having, again, back issues, how you can sort of, diagnose specific vertebral levels and try to help make that correction. So, it's definitely a skill set that it's definitely a lot to learn, but I'm definitely appreciative of it. So,
yeah. I remember I did my, in med school, you do a weight rotation, or you do whatever, like a rural rotation. So I went to Mizzou for med school. I did a rural rotation.
Yeah.
And my doc was a DO doc that I worked with. I remember people coming with sinus disease. Yeah. And she would have them put your head back and she'd do this percussion on the sinus.
Yeah.
So I learned that from her. So when I get stuffy, still I'll do that.
They're doing great. Yeah. I think there's this one technique that I always use when people come in with like headaches, and within like a matter of minutes, it can resolve your headache. And so I love doing it. I call it like my little like trick, but it's definitely really fun to use, and it's nice when people do have that relief of pain or whatever it is, and it's very like gratifying. So.
All right, so we'll push up on time, but I want to get to some fun questions up here. But before I do, both of you are chief residents.
Correct. Yep.
How did that happen? That's bonkers. How did that happen? Well, first of all, kudos, congrats.
Thank you, appreciate it.
But tell me about that. So that means you guys are killing it, right? That means you guys are doing great.
I try right now. So our
how did that happen?
I know it's. I mean, to be honest, initially, I wasn't really so focused on being chief resident, which is kind of like crazy part. People
me either.
That initially that's like their like goal and they're like, they're like mission, right?
Yeah.
So initially I wasn't really focused on that until it kind of came time to, express interest. And so, ultimately it came down to, it came down to the vote. Our peers, voted, and our program director and associate program director had their input. And at the end of the day, they ultimately really wanted us to do the job. And I was like, wow, I didn't really think that, I was being thought, I guess, so highly of in that moment. But it really kind of, again, that was like a mental moment. There was like, wow, maybe I can do more than what I think of myself. Right. And so with that being said, we essentially took it on and took on all the responsibilities that come with that. And it is just another moment for us to grow as leaders and to, again, work together in what we're doing. And so, I'm glad I'm doing it. I definitely have no regrets or hesitations. I would say definitely do it again.
Right.
So it's been a fun year. We plan out a lot of didactics, and we approach a lot of, talk to a lot of attendings and schedule things. So, it's definitely a lot, but it makes you better. I've learned that, it makes you better at how to manage issues, how to manage problems that arise, whether it's, amongst the residents or things that, you want to address at an administrative level. And so, I'm grateful for the experience, to be honest, and to be, I feel like I've noticed a personal growth within myself, being in this position. And, so,
I'll say definitely. I think this past year being chief really has taught me just a lot in how to lead and how to, resolve issues and conflicts that arise and really just how to better communicate with people, and it really teaches you how to really see, both sides of one story, and trying to acknowledge both sides of one story, and really just try to meet people in the middle and kind of that whole thing. So it's really been
conflict resolution.
Yeah. So it's really been, I would say, like an eye-opening experience. But coming from the perspective of, I can't say I was gung-ho about trying to apply and be cheap, but now seeing it from the other perspective, I'm glad that I did, because I think it's taught me a lot of things that I can really apply going forward.
Yeah. So a lot of peers encouraged us to go for it, and I was like, you know what, if you guys really, you really want me to, to be in this position, and you really think that I have what it takes, and I'll do it. And I think it's one of those moments where, you can have other people that uplift you and can place you exactly where you're supposed to be. So
I think that's huge. I think, at the beginning we talked about don't be looking for external validation, but it's okay to get that confidence boost externally.
Exactly.
Let's have a little bit of fun. So
all right,
I'm gonna ask y'all to close y'all's eyes, both of y'all, and then I'm gonna ask you a question, like it'd be like, who's more likely to do this, or who, blah blah. And if it's you, just point to yourself. If it's the other, point to the other.
All right, let's do it.
And then when it comes out, you guys will be able to watch it. So I'm not gonna tell y'all who did what. When it comes out, y'all be able to watch it. I'm just gonna make up the questions as I go. All right. So, all right. Eyes closed. All right. So the first question: who's more likely to win the tennis match? Who is more likely to trip over their shoelaces? Who is the better chief resident? Who's the better cook? Who is the better dancer? Who's better at Taekwondo? Who's better at piano?
Ooh. I don't know about that one. That's, you're trying to start a fight.
Yeah, let's not do this part of proof. Let's not do proof. Okay, let me ask a few more here. Golly, it's hard to think about these questions, and I thought, who dresses better?
Ooh, that's a good question.
Wow.
Dang, I don't have an answer. I don't have an answer for that one. I don't have an answer for that one. I'm just going to say,
in a critical situation where a decision needs to be made, who's more likely to make the better decision?
Wow.
I only got one vote so far. All right, 2 votes. All right. How about this? And then how about the last two? Each one of you ask a question. So Jeremy, you can ask one, and Jermaine, you can ask one.
Okay, I guess I can ask. This one's pretty good. Who is usually the more talkative one on any given day?
All right. Next question.
Gosh, I don't have a question. Let's see. I would say, who's the more spontaneous one?
Okay. And here's another one. Who's more likely to be late for an event? All right. Good stuff, guys. Good stuff. All right. And that was fun. So y'all will see it when the episode drops, so y'all can see what each other says. Let's not have a Taekwondo fight, please. Let's not do that. Excellent. So really appreciate you guys. I mean, you guys, obviously medical stuff, you guys are doing a phenomenal job, chief, as evidenced by your peers, encouraging you to become chief residents. And I'm sure you guys are doing a phenomenal job at it as well. But even beyond that, the stuff that you guys do on social media, people, and I'll be in all honesty, I'm not the biggest kind of social media person. I do stuff, I do stuff out there, whatever. But like I said, my brother does anything Black men and white culture social media. My brother's probably the one kind of driving it. So yeah. But I go in there and I do follow and I pay attention to some stuff, from time to time, and I spend some time, obviously, look at you guys' stuff and stuff you guys are doing is actually, huge stuff, important stuff, and in an entertaining way. to educate people, which is huge. You think about how do you really have an impact in medicine? You take care of patients and such. You guys are having an impact that's going to be not going to be it is. You can't even quantify how big that impact is. You can't quantify it. Not only the medical stuff, but the fact that you're two Black men doing that's huge, man. Huge.
Yeah. And that's part of the biggest message that we try to drive, that we want to drive home is that, it's long story short, it's just that we're more than Black men in hoodies, and we're not, we're more than a hoodie, we're more than what's on the news about us, right? And there's so much good that we're doing out there that doesn't get covered, to be honest. Doesn't get highlighted and spotlighted, and it's always tends to be more of the negative things. And so that's why part of what we're doing, and it's similar to part of what you all do, is to put a face to medicine, put a face to what's actually going on, is to show that, hey, we're doing these other awesome, amazing things too. And part of some of our experiences that, we've been enabled to be a part of have just been, amazing, whether it's, again, doing the keynote address at SNMA, never would have thought we would be the ones to be able to have that opportunity. Whether, we recently were in New York City and we did a health summit. It was for an organization called Black Health Matters. And, we talked about, we had different sessions. And for us, we talked, of course, a lot about COVID and the vaccine and especially the hesitancy within the Black community with getting the vaccine, and just, address and answer questions. And, these are things that I really would say are what makes the difference. I think COVID has taught us all that, being in the hospital and treating patients is one thing, but educating and being a part of the community outreach is where the battle is, really is. You have to really put yourself out there and spend that extra time to educate outside the hospital and, talk to people in the community and so I would say, but that New York City event also was pretty amazing. There's so many amazing people that were involved, and just an opportunity to really talk to a lot of amazing people. So
that's all, man. Y'all had some huge folks out there. Y'all had goodness, man. I know Tatiana Ali was there. And y'all had some other folks.
Yeah, there's like Malik Yoba. There was
Yoba was there.
Yeah. Got a photo with him. Of course, we had to do that one.
Y'all probably too young to remember New York on the cover. You remember that?
I've heard of it because everyone keeps telling us about it. But I'm like, I've not actually seen that show. But
it was such an awesome show, man. Detective Torres. It was an amazing show. I'm sure y'all saw Cool Runnings.
Yeah. Yep. But it was really amazing, and just to see again people come together for that, trying to help educate and talk about these health issues in the Black community was just really an amazing experience, one that I would do 100 times again. So.
It's definitely, I think that's kind of what we live for now, is just being able to do those kinds of things, and just kind of how we were saying in the beginning, like what impact do you want to have on people? And I think that really kind of really check marks the box for us in terms of like what our goals are, and how do we want to leave our mark.
Yep, absolutely.
I love it. Hey, appreciate you guys for being on the episode today. And
thank you, Dr. for having us. Definitely appreciate it.
So to the viewers, can you guys just tell us your handles, social media handles again, just for the viewers?
So we're Twin Doctors J on Instagram, TikTok especially. YouTube, we're starting to grow our page, and eventually we'll start putting out more content there, and Facebook as well. So Twin Doctors J, and people always ask us why is it Twin Doctors J? Because we're twin doctors, and both our names are J. And actually, the story behind that is actually, even when we were in college, people wouldn't know who we are. Still, they'll just call us J. So we're like, all right, we're J. J and J can't get it wrong.
Y'all should sue Johnson & Johnson.
Right, they took our name, right? Took my name, Johnson & Johnson.
All right, so here's how we'll wrap it up. So, great show. Thank you again. If y'all could both just say, my name is Dr. Jermaine Hogstrom. My name is Dr. Jeremy Hogstrom, and we are Black Men in White Coats. And that would be a perfect ending to all of this.
All right, let's do it. So my name is Dr. Jermaine Hogstrom.
And my name is Dr. Jeremy Hogstrom. And we are Black Men in White Coats.
Ain't no time for stressing. I've been really stepping. Ooh.